The Auditor-General provides assurance to Parliament on the accountability and performance of the Victorian public sector. The Auditor-General conducts financial audits and performance audits, and reports on the results of these audits to Parliament. Heatwaves have been called the silent killer. More people in Australia are estimated to have died from the impact of extreme heat on their health than from the impact of other natural disasters. There is no single accepted definition for a heatwave. Two definitions are provided on the current slide. The lack of a consistent definition of a heatwave has implications for heatwave plan response arrangements. Heatwaves represent a significant risk to public health. Heat-related illness ranges from mild conditions such as a rash or cramps, through to heat exhaustion, and finally to very serious and potentially fatal conditions such as heat stroke. Extreme heat events can also exacerbate pre-existing conditions, including cardiovascular disease, diabetes, and cancer. The aged, infirm and isolated, young children, nursing mothers, and people on certain medications are all vulnerable. Heatwaves can also affect the capacity of health and emergency services to respond to increased demand. In 2009 and 2014, Victoria endured periods of extreme heat of unprecedented intensity and duration. The red text shown in the table highlights the maximum and minimum temperatures endured by the state during those periods. The attribution of deaths due to extreme heat is generally based on the number of excess deaths, deaths that have occurred in a particular period, compared with what would normally be expected to occur in that period. For example, during the week of the 2009 heatwaves, there were 374 excess deaths compared to what was expected for that week. By contrast, there were 173 deaths associated with the 2009 Black Saturday bushfires. The impact of extreme heat on public health is also felt by public health services. For example, on the 17th of January 2014, the Emergency Services Telecommunications Authority, ESTA, experienced the highest number of calls ever received for ambulance services, 2,553 calls. The 2009-10 Heatwave Framework, developed by the Department of Health, is designed to reduce the impact of extreme heat on public health. It consists of 5 main elements, including a heatwave plan for Victoria, which is aimed at coordinating the response to heatwaves, and a heatwave planning guide which is intended to assist municipal councils. The framework also includes a heat health alert system, which monitors climate conditions and alerts stakeholders when temperatures are expected to reach or exceed a community's threshold temperature. The impact of heatwave on human health is monitored and assessed through the Heat Health Information Surveillance System. The framework also includes a range of communication resources to keep stakeholders informed. Our objective was to determine whether applying the Department of Health's heatwave framework has been effective in reducing the impact of extreme heat on public health. To meet our objective, we assessed a range of outcomes, procedures, systems, and messaging associated with heatwave management. The audit included 11 public sector agencies. On the basis of the evidence collected, we concluded that, while there was a reduced estimated number of excess deaths associated with the 2014 heatwave than with the 2009 heatwave, the Department of Health is not able to clearly attribute this outcome to the implementation of its framework. We concluded that the heatwave framework is soundly based. It includes many of the elements accepted by international health and meteorological organisations as being essential to respond to the significant health risks associated with heatwaves. Nonetheless, there are a number of critical gaps that were identified in the 2009 heatwave debrief that are still issues in 2014. More specifically, we concluded that there are 5 key gaps across areas including governance, planning, activation of heatwave plans, risk management around critical infrastructure, and public health messaging. The following slides provide a breakdown of each of these identified areas. In terms of governance arrangements, we found that roles and responsibilities for managing heatwave incidents are not clear or well understood by agencies. For example, Victoria Police's role as control agency for heatwaves was intended to be an interim arrangement. However, this arrangement has not been reviewed. We also found that monitoring and reporting arrangements are not adequate, given the significant risks associated with a heatwave emergency. For example, State Control Centre daily briefs show that most of the information reported, as the 2014 heatwave progressed, was on preparedness for the consequential impact of fire, with no equivalent mapping for extreme heat impacts on the community. There is no mandatory requirement for agencies to have a heatwave plan, and there are no clearly articulated minimum requirements to guide development of state-level incident plans. The heatwave plan for Victoria is not a state-level plan. While Victoria has a state tsunami emergency plan and a state earthquake emergency plan, there is no equivalent state-level plan for heatwaves. While municipal councils might develop heatwave plans as sub-plans of their municipal emergency management plans, the currency and quality of heatwave plans is not monitored or reviewed. Activation is not well understood by agencies and is applied inconsistently. Activation by a council could mean anything from sending out a summer newsletter, forwarding a heat health alert, or establishing an incident control centre. The department's heat health alert system does not follow the Victorian warning protocol by issuing warnings in a phased approach. A phased approach would assist agencies to activate their plans in a timely way. In relation to resourcing and critical infrastructure, we found that sufficient and appropriate resources are not always available to respond to heatwaves. Reduced staffing over the summer months affected agencies' ability to respond effectively during both the 2009 and 2014 heatwaves. For health services, a significant risk during a heatwave is failure of critical infrastructure and the performance of emergency generators. We found that there is insufficient assurance that health services are prepared for the risk of critical infrastructure failure. We found that the heat health alert system used by the Department of Health is soundly based and accords with best practice internationally. However, the alerts are being selectively applied. The issuing of heat health alerts by the Department of Health is selective and based on trigger locations. For example, in 2014, in some cases, no alert was issued when a location was at or above threshold. Agencies were also selective in how they disseminated the alerts to the community. Public health messages are targeted at the most vulnerable in the community. While this is important, the messages also need to target the whole community. We made 8 recommendations aimed at improving heatwave management. 4 of these, included on this slide, were directed to Emergency Management Victoria, and 4 recommendations were directed to the Department of Health. Each of the recommendations has been accepted by Emergency Management Victoria and the Department of Health. As part of the Auditor-General's new follow-up process, agencies will be asked to report on progress made on implementing recommendations within the next 12 to 18 months. Other relevant audits include Managing Emergency Services Volunteers, tabled in 2014, Flood Relief and Recovery, tabled in 2013, and Emergency Response ICT Systems, tabled in 2014. Next year, we will also table an audit on emergency service response times. All our reports are available on our website. If you have any questions about this or other reports, or if you have anything else you would like to discuss with us, including ideas for future audit topics, please call us on 03 8601 7000 or contact us via our website.